How's it going? Jack from Longevity Minded. We're going to try a different format for this article, mainly because of some visual aspects that would be hard to go over without having the visual cues on screen. So here we go. The Four Horsemen. Understanding the four chronic diseases that kill 80% of people within industrialized nations. Life and death. Within industrialized nations, there are four diseases, or more specifically, types of disease, that kill an overwhelming majority of the population, around 80%. Since we will probabilistically die from one of these diseases eventually, a large part of extending lifespan boils down to finding a way to delay the onset or mitigate the likelihood of these diseases. By doing so, we achieve three key benefits. Number one, extend the duration of our lives, increased lifespan. Number two, increase the quality of our lives, increase health span. And number three, minimize the time or percentage of our lives spent in a state of suffering that underpins these diseases. The function below with lifespan, years lived, on the horizontal axis, and health span, quality of life, on the vertical axis, portrays these three benefits. So here's a graph. This was first derived from Peter Attia, who picked this idea up from. And the idea here, as we'll get into, is that we're pushing out lifespan and pushing up health span. So the blue arrow represents benefit number one above, which is an increase in total lifespan. In this theoretical example, life has been extended by 10 years. Of equal, if not higher importance, is the change denoted in the red arrow, which is an increase in health span. If we think of the curves as lives of two different people, who's living a better quality of life at age 70? Of course, it's the person on the top curve. If we follow it up, age 70 is somewhere around here, and quality of life is, I guess the delta between these two is the difference in quality of life, or the improvement on the top curve. So they found a way to retain much more of their mental and physical function, and thus maintain greater control and independence for a longer period of time, thus leading to a much higher quality of life. In comparison, the person following the bottom curve is losing their independence at an exponential rate, and as a result, spending a much longer period of time living a lower quality of life. This leads to the third benefit, which is minimizing the percentage of our lives that is spent in a state of suffering or suboptimal living. So graphically, we can see this concept is represented in the tails of the two curves as the lines approach zero on the horizontal axis. And this can be seen in the difference between the slope of the two curves. The top curve shows a longer life, of which the majority was lived in near or peak physical and mental condition, with a sharp decline ranging from a couple months to a year and a quick death. Contrasted with the life of the person on the bottom curve, who spends 2 decades or 25% of their life between the ages of 60 and 80, losing these key functions at an increasing rate. So if you compare these two lives, of course, the life of the top curve is much more optimal. The difference in the slope here between this curve and this curve, we can see this person spends much more time in a slow decline, whereas this person is living a pretty high quality of life all the way along until they almost have a straight drop off in the last couple months of their life, at which point they decline and die fairly rapidly. So we're aiming for this pushed out and pushed up curve on the top here. So translating graphs and theories into practice, this means that the individual who figures out a way to ride the top curve will be walking, socializing, cooking, driving, bathing, dressing, and otherwise able-bodied and living independently, while their less informed comrades file into nursing homes to have others perform these functions for them. Whatever it is you want to be able to do in your 7th, 8th, or 9th decade, you have to start living a lifestyle now that will allow you to do those things in the future. The 5 levers I first outlined in the longevity framework guide our strategy and inform our tactics to align our lifestyles with the goal of increasing longevity, which means increasing lifespan and health span. One of the most essential aspects of achieving this goal is finding a way to delay the onset or minimize the likelihood of the 4 diseases this article will introduce. If we can find a way to do so, we've won half the battle in living a longer and healthier life. So, onto the horsemen. In order of mortality rate, highest to lowest, the 4 diseases that kill the vast majority of those living in industrialized nations are atherosclerosis, so things like cardiovascular disease, cerebrovascular disease, stroke, heart attack. Number 2, cancer. Number 3, neurodegenerative disease, so things like Alzheimer's, Parkinson's. Number 4, metabolic disease, so NAFLD, which is non-alcoholic fatty liver disease, NASH, IR, which is insulin resistance, type 2 diabetes, and hyperinsulinemia. The 3 predominant categories of chronic disease, atherosclerosis, cancer, and neurodegenerative disease, all have strong links to underlying metabolic diseases. In other words, metabolic diseases are really the cause of death, but are massive contributors to the development of the other 3 diseases. So we can see in this graphic here, it's kind of represented. We have these 3 pillars, and all of these are greatly contributed to by metabolic disease. So, things like having elevated blood glucose for long periods of time over your life contributes to cancer, neurodegenerative disease, and atherosclerosis. So we're looking to minimize metabolic disease, and as a result, hopefully decrease our risk of these other 3 diseases that do kill people. So let's look at a deep dive of each of these. Atherosclerotic diseases such as coronary heart disease, heart attack, and cerebrovascular disease, stroke, are defined by the thickening or hardening of arteries caused by a buildup of plaque in the walls of the arteries. Over time, this buildup narrows and it makes it difficult for blood to flow through the arteries. If a blood clot forms as a result of a ruptured atherosclerotic plaque, which is responsible for 99% of heart attacks in the US, blood flow may be blocked, causing a heart attack or stroke. Combined, diseases of atherosclerosis are the leading cause of death in industrialized nations, followed by cancer, although we see that gap is narrowing. Compared to cancer and neurodegenerative disease, we have the best understanding of atherosclerotic diseases from a prevention, risk assessment, diagnosis, and medical intervention standpoint. Diseases of atherosclerosis are time exposure diseases, meaning that the risk increases the longer you're alive. Because of this, there's a compounding nature to atherosclerosis, which means that there's a high risk of incident in atherosclerosis going from your 50s to your 60s compared to going from your 30s to your 40s. Cardiovascular disease is the blanket term we use for diseases that impact the cardiovascular system, which is the system responsible for the circulation of blood and everything blood contains throughout the body. The most common types of cardiovascular disease are coronary heart disease, heart attack, and cerebrovascular disease, which is stroke. When discussing atherosclerosis, actual or perceived with your doctor, there are 2 key questions that should be discussed. How do I feel, which is the presence or absence of symptoms, and is this going to impact how long I live? Common risk factors of CVD are smoking, diabetes, a lipid disorder such as severely elevated LDL cholesterol, and as mentioned previously, age. Although atherosclerosis progression over time is inevitable, the speed at which it progresses is partially up to us. We can alter conditions in our favor, such as sleep, nutrition, and exercise, in order to reduce the rate at which plaque accumulates. On to cancer. Shockingly, 50% of women and 33% of men within the US will be afflicted with cancer in their lifetime. Within Canada, the Canadian Cancer Society expects 43% of women and 44% of men to develop cancer in their lifetime. Although risk often increases with age, similar to atherosclerosis, cancer lethality is highest among those aged 45 to 65, killing more people in that age range than heart disease, liver disease, and stroke combined. Cancer can originate from 3 places, including outside the body, such as melanoma and colon cancer, inside the body, like brain cancer and prostate cancer, and in the blood, such as leukemia. Aside from taking actions to prevent cancer, screening for cancer thoroughly and often in order to detect it early is one of the most important things we can do to reduce the likelihood that if we do develop cancer, it will be life-ending. It's useful to think about cancer in a 3-step framework. Step 1 is to try not to get cancer. So start with low-hanging fruit by not smoking and maintaining a healthy weight. Step 2 is look for cancer early. Screen aggressively and often. How to screen is probably a topic best discussed with your doctor. But there is one approach that Peter Attia likes to refer to as like the Swiss cheese approach. So it's looking for ways to leverage different types of cancer screening technologies because each technology has a gap or a hole, but by layering them on top of each other, we can minimize the likelihood that cancer gets through as different technologies cover the holes in other technologies. And then step 3 would be to, if cancer does exist, use therapies that go after multiple pillars simultaneously. So immune system, epigenetic regulators, growth factor receptors, metabolism. And again, this is to be discussed with your doctor. In a case where one does develop cancer, there are 3 pillars to treating it: chemotherapy, radiation, and surgery. Chemotherapy attempts to solve the paradox of killing cancer cells while not killing non-cancer cells. It's not actually difficult to kill cancer cells, as you can kill them with pretty much any chemical off the shelf at Home Depot. The problem is that those chemicals kill everything perfectly, so they'll kill non-cancerous cells as well. To get around this and try to solve this problem, chemotherapy attacks the things in our bodies that grow, so preferably targeting the cancer cells, but this also explains the reasons for hair loss in chemotherapy treatment. Radiation is a useful tool to locally control cancer, meaning to stop cancer at its origin of growth. And lastly, surgery is a procedure performed to cut out cancerous masses such as tumors. Again, if cancer does exist, this should be a point of discussion with your doctor, but there is more information on this framework I described in a link I'll post in the show notes. Neurodegenerative disease. So dementia is the umbrella term that categorizes diseases recognized by a change in memory or other areas of cognition. The key indicator in the development of these diseases is a change from a previous state, so you're not born with it, that interferes with day-to-day function. There are many types of dementia. However, since Alzheimer's is the most common, we'll focus on it most going forward. Almost everyone knows someone who's been afflicted by Alzheimer's disease. Based on that anecdotal evidence, we can all agree it's one of the most disheartening and despairing diseases to watch a loved one endure. Although we won't all suffer from dementia, nearly all of us will die with some form of cognitive impairment. Instead of letting this depress us, we should use that knowledge to inform our life philosophy. Don't wait for someday. Do the important things, the things you dream to do, now while you still have the chance to experience them with full cognitive and physical function. How well we feel we're aging is impacted by how much regret we live with. So don't leave any room for regret in your life. The only thing that can make watching someone living with dementia more depressing is having the knowledge that they didn't live the life they wanted to. So get out there and start living. And then lastly, we have metabolic disease. So common metabolic diseases include non-alcoholic fatty liver disease, NAFLD, non-alcoholic steatohepatitis, NASH, insulin resistance, type 2 diabetes, and hyperinsulinemia. Although people generally don't die from these diseases, they contribute heavily to the development of atherosclerosis, cancer, and neurodegenerative disease. Metabolic diseases are closely associated with being overweight and having an inactive lifestyle, and are often linked to a condition called insulin resistance. Although we'll dive deeper into these topics later on, it's important to note now that losing weight, exercising, and maintaining healthy dietary choices is critical to improving metabolic health. So forging ahead. The purpose of this article is intended to be a brief introduction to 4 incredibly complex diseases that are omnipresent in our society. Our understanding of these diseases is constantly changing as new research emerges. Nearly everything must be talked about probabilistically when engaging in discussion regarding health in general, and certainly within the domain of these diseases. Beginning with an awareness and a basic understanding of these diseases allows for future discussion regarding how we may go about preventing, diagnosing, and treating each of them. The scope of the longevity-minded newsletter will focus more on the prevention aspect, as that's where I feel I can provide the most value to you. The diagnosis and medical intervention of these diseases are tremendously complex to understand, let alone to accurately simplify and disseminate for the comprehension of those lacking a scientific or medical backgrounds, myself included. Future newsletters will work to further demystify these diseases, to which, as a society, we're largely ignorant and uninformed due to cultural taboos and gaps in the education system. Gearing your lifestyle towards the first 3 levers, sleep, nutrition, and exercise, will put you leaps and bounds ahead of the general population in mitigating your risk for these diseases. And next week, we'll be looking at lever number 2, nutrition, its 5 sublevers, and the simplest way to transition away from the standard American diet and the cult-like mentality around dietary restriction. Always happy to hear feedback by leaving a comment or reaching out to me on Twitter or Instagram at Jack Dixon. Much love, Jack.